You are listening to KCC Live 99.8 FM each and every Monday with me, Miguel. And as you know, I've been saying for a little while, I'm going to be taking over the breakfast show and bringing in some guests. So today is absolutely day one. I'm super excited to be here. We've got lots to talk about with our incredible guest. Say hello, Laura.
Hello.
So, do you want to tell everyone who you are, a little bit about yourself and why you're here?
Yeah, my name's Laura Rose. I'm from the Axess Sexual Health Service. I'm a community outreach worker and I am coordinating this year's National Testing Week campaign.
Fantastic. So, talking about National Testing Week then, explain to any of our listeners who don't know what this is. What is it?
So, National Testing Week was set up to coincide with World AIDS Day. So it was a way of getting people out there and testing for HIV. But because of COVID, it was delayed last year to February. So Public Health England has kept it in February. So it's now separate to World AIDS Day, which is great because it means we can get the message out there twice in a year. So it was basically a way of promoting HIV testing amongst lots of different communities and getting people to know the status. So there's 3 different statuses in terms of HIV. So you can either be HIV positive, HIV negative or unknown, which means you've not been tested and you don't know what your status is. So one of the main aims of this campaign is to get everybody to know the status.
Okay, so what type of things are you doing to get people to get tested? Are you doing pop-ups? What is happening?
Yeah, so but in lots of different places. So Axess covers a massive area. So we cover Liverpool, Warrington, Knowsley, Halton and Cheshire East. So our outreach team are going to be out there all week in lots of different community places, like homeless hostels, but we're also going to be in colleges, halls of residences, schools. In terms of schools, what we've done with them is we've sent out information resource. We've done a free educational resource that anybody can download from our website, and it gives information on STIs, what STIs are around, what the symptoms are, who should test, and how to test, so where to access testing from. So you can access free testing from our website, or you can come into one of our clinics and be tested as well. So we're going to be on all our socials. We're going to be through our trust. So we work for the Liverpool University Trust. So that we're going to be promoting Testing Week through that as well.
You're listening to KCC Live 99.8 FM each and every Monday with me, Miguel. And as you know, we're joined by the fantastic Laura. So Laura, we came across each other way back through Emma when we started St. Helens Pride.
Yeah.
Here. So from that, what have you gone on and done?
From then, I left St. Helens and moved to working for Liverpool, still in sexual health, still a lot around working with the LGBT plus community. But because of COVID, we've not been able to do a lot in terms of Pride, unfortunately. But I'm still working in sexual health, still working out in the community and spreading positive messages.
So, I chatted a little bit about this to you before. Why did you choose to work in sexual health?
I've always worked with young people. So since I graduated with a degree in community studies, and worked with homeless people, I worked with an anti-bullying helpline, I've worked in alternative education, always with young people, and I was always surprised by the lack of knowledge around sexual health. So I've done some training so I could give positive messages and help people to make appropriate decisions. So what I did notice when I've worked with youth and youth background was people not understanding consent, people not understanding who should test for STIs, a lack of understanding around preventing pregnancies. So I'm just dead passionate about getting the messages out so that people can make positive choices, but informed choices about their lives as well, and that people shouldn't be judged around sexual health. We all have sex. It's how we're all here, Yeah. And it's okay to look after your sexual health as well. It's absolutely nothing to be ashamed about. So just something I really feel very passionate about.
So obviously, some people do get embarrassed and aren't as open.
Yeah.
So, when you're delivering a session, and so you go into a room and people are, and if we're looking at trying to, reassure people who might need to pop into some of these places, or they need to come for contraception, or they need to get tested, some people are going to be shy or fearful. First of all, if you're delivering a session and you've got a group of young people who are adults and they're nervous and they're embarrassed, what you do to calm the situation down?
It depends on the group, really. My colleague Kerry has come up with a brilliant icebreaker that we used last year when we went out to NCS in Warrington. And it's a list of different words to do with sexual health, so sexual health related words. I won't say some of them because this is on too early in the day. But what we do is we ask a young person to volunteer to see the words. It's kind of like Pictionary in a way, but it's using the words. So let me think of something that I can say in the morning. So say relationship. So somebody would get up and say clues to what that is. Might be one night stands, things like that. So it creates people laughing, and we very much make it known to the group that it's okay to laugh. Sex should be fun. It shouldn't be something to be embarrassed about. So straight off the cuff, we always do an activity around getting them to laugh, getting them to say some of the words they don't want to say, even if we're the ones to say it and they don't know if they can laugh. I'm like, no, it's okay to laugh. Just trying to get them trying to discuss it straight away rather than don't be too shy about it at first. I'm not making any sense.
No, because I think what has been is really good. So, we've worked with your team before, and they've come in and done sessions with our creators who come to the academy, and it starts, with, you can see them all, they're like, oh my God, but you just create a really safe, comfortable environment. And now, our young people in here can't wait for you guys to come in. It's been like a sigh of relief. It's a safe space to them. They feel confident and comfortable and confident in talking and open up to you. And something I found in the sessions as well is that, some of the young people have felt like, is this a silly question? Whether that's been around HIV or contraceptive, and the space that was held made it okay to ask any question, and it's been really reassuring.
That's always one of our ground rules, that no question is a silly question. It's okay to ask anything. And also, we can't expect everybody to want to talk to us and not be shy about it. So we also, every time we go out and do a session, we leave space at the end of it. If anybody wants to stay and ask us, they can always go through a member of staff. If they wanted to ask a teacher later, they can send us the question at another time. We open it to loads of different avenues for people if they're not comfortable, because not everyone's going to be comfortable. But hopefully we remove some of them barriers by doing some icebreakers straight off.
Brilliant. Okay, well, we're going to take a break, and when we come back, I'm going to speak about the different groups, different ages, and how you face the different challenges. To KCC Live, 99.8 FM, each and every Monday with me, Miguel. And as you heard, I'm joined by the fantastic Laura. So Laura, we've been talking about embarrassing things, why you got involved, National Testing Week. Nationally, we're talking about HIV. Yeah. But locally, you're saying testing across the board. Yeah.
So the aim of our campaign is to promote testing for all STIs. Yes, testing for HIV is really important. So HIV Testing Week goes from the 7th to the 13th of February. And straight after that is Valentine's Day. So our tagline is all you need is love, with a question mark. So do you just need love, or is there other things involved with having sex? So we are promoting testing to anybody who's sexually active. So it seems to be people who are in relationships don't always think that there's a need there to test. But what we think is, even if you just test once a year, it's about peace of mind. Try and make it as part of your annual health checks anyway. If somebody's not in relationships but they are having sex, we recommend testing with every new partner, or at least every 6 months. We are promoting testing for HIV and syphilis, which is done through the same test. So it's done through a blood test, and in the lab you test for both HIV and syphilis. And then we also test for chlamydia and gonorrhea. The testing for that is different depending on somebody's biological sex. So it's either a urine sample or it's a swab. And that is a dual test for chlamydia and gonorrhea. So while we're promoting HIV testing, why not promote to everybody to test for everything?
So in terms of the uptake and response, do you find it's different between different genders, sexuality, age groups? What's the differentiation? Yeah,
so we have a lot of women coming to our service for contraception, and they tend to test regularly. We promote testing to them. We also have a lot of men who have sex with men who come to our service and test regularly. We don't always have a lot of young straight men, unfortunately. I don't know why. I don't know whether that's like again to do with being embarrassed or not, or thinking it's the girlfriend's responsibility to sort out the sexual health, but they are just as at risk as everybody else. If you have an unprotected sex, you're at risk. We have a good uptake of online screening for young straight men, but actually coming into clinic if they've got symptoms, we could do with up on that a little bit.
Okay, well, when we come back after the break, I want to ask you some questions around transmission, rumours, medication treatment, and again, how the world has moved on.
Brilliant.
KCC Live 99.8 FM each and every Monday with me, Miguel, and we are here talking about National Testing Week with Laura. So before the break, we were talking about people who may not feel they need to get tested, and TV shows that have maybe portrayed a different character of what's out there, or a lot of people may still be scared of the 80s. In terms of where we sit now in the world and where HIV is, in terms of precaution, treatment, do you want to give an insight to some of our listeners who may not know, where we sit in the world today?
Yeah, so anyone who is tested positive for HIV are put on treatment. So it used to be they might be on up to 20 tablets a day. Now, majority of our patients only take 1 tablet a day, and that tablet suppresses the HIV virus so much that they become undetectable. So undetectable equals untransmittable. So that means somebody who's living with HIV and is on effective medication can't pass that on to somebody else. We've also got what's called PEP, which is post-exposure prophylaxis. And that is for somebody who might have had sex or unfortunately might have been a victim of sexual assault. And there's a risk there of catching HIV. So you can take PEP up to 4 weeks. The sooner that's taken, the better. So if somebody can access that from one of our clinics, or if they need it over weekends, they can access it from A&E.
So if they've had sex or been involved in an incident, and then up to 4 weeks they can take this, and
it's a 4-week course, but you need to take it within the first 72 hours, preferably the first 24 hours, just to make sure it's more effective. There's another called PrEP, which is pre-exposure prophylaxis. So if somebody is in a relationship with somebody with HIV, even though they're undetectable, there is an extra precaution they can take, and it's called PrEP. And it's a medication that people can either use every single day, and they're monitored through our service. They'll come to our service around every 6 months. They're tested for all STIs, and they're also made sure that risk of HIV remains really low. Other people take it kind of like incident based. So if they know they're going to go out and potentially have unprotected sex, you can take PrEP just for a few days, and it'll stop you from catching the virus if you have had sex with somebody with the virus.
And this is available to anyone?
It is, yeah. It never used to be. It was on a trial, but it is now available. So you can get it from Axess Sexual Health, and you can also be assessed regularly through Axess as well. You can buy them online, but it's safer to come to an NHS service to get them.
So do you feel that in terms of treatment, etc., the world has moved on a great deal?
Oh, absolutely, yeah. The aim is to be free of new HIV positives by 2030, and the way that we're going, we are actually on track for that in the UK. So around the last time data was produced, it was 2019. There was over 105,000 people living with HIV in the UK, but only 94% of them knew that they had it. So there is people out there who are undiagnosed, which is why it's so important for everybody to go and test. But absolutely, we've come on so far. The fact that you can't pass it on to somebody is amazing, because there's no other STI that's the case. If you've got chlamydia, gonorrhea, syphilis, and you haven't protected sex with somebody, it's really likely you're going to pass it on. HIV, it's not like that at all. And also the good thing with it is people can live long, healthy lives. There used to be a death sentence over people's heads if they were diagnosed with HIV. People can go on to live as long as anybody who doesn't have HIV. So it's amazing, really. And if you watch things like It's a Sin, it just shows how amazing we've come on in 30, 40 years.
So in terms of testing then, do you want to explain to our listeners what would happen in a test? If they
So to test for HIV, it's a blood test, and there's a few different ways you can do it. So in our testing events for outreach, we're going to be doing finger prick testing. So we take a bit of blood out of someone's finger, and we squeeze it into a little vial, which sounds awful, but it's not painful. And we can send that off, and they'll test for a reaction in the blood for any sort of virus. if there is a reaction in the blood, then people can come to our clinic and they can confirm whether that is HIV or a different virus. Have a reactive result, it doesn't mean it's positive, so they would then come to us and we do a further test. And syphilis can also be tested with that same test. If somebody comes into one of our clinics, they'll have bloods taken from the veins, and then results are really quick, around a week. There's a window period with them, so from having unprotected sex to being tested for HIV, we recommend 4 weeks. So if you test before then, you might have a false result, so you might get a negative, but it might actually be positive. So we always recommend to patients to wait 4 weeks. If it's for syphilis, we say to wait 12 weeks, exactly the same reasons. For chlamydia and gonorrhea, we do either a urine test or a swab. So it could be vaginal, rectal or throat swab. It depends on where the risk has happened. And the window period for that is 2 weeks. Okay,
so for any of our listeners out there, do you have a message for them?
Yeah, I think the message is don't be embarrassed about your sexual health. It's great if you are in a relationship and you're really happy. We're not trying to, portray any negative message. We just really believe that if you test regularly, you can have peace of mind, that you are safe and you are negative and you're not passing anything on to anybody else, and to know your status.
So if anyone wants to know more about you guys or where they can find you, how can they do that?
So you can go on our website, which is axess.clinic. And they can go on our socials, which is Axess_SH on Instagram and Twitter. Our phone number to ring, so our phone lines are open every day, Monday to Friday, is 0300 323 1300.
Okay, so what I want to know is a little bit about the name. So obviously people are going to look for us on social medias and it's going to be Axess. But obviously it's spelled a different way and there's something that is within the message. Do you want to explain to our listeners?
Yeah, so the brand is Axess, so it's spelled AXESS. And on our logo, we have sex written backwards in the logo, just so it looks a bit unique and so people can recognise us.
Brilliant. So guys, it's National Testing Week, and as we said, we're not just supporting this week, we're supporting it ongoing. We mentioned a little bit before about social medias, but where can people find you?
So you can find us on Instagram and Twitter, and it's at Axess_SH.
And she's mentioned a little bit before how it's spelled, so make sure you put it in the correct way.
Thank you.
Well, it's been absolutely amazing to have you in here. It's been great to see you again. Guys, as you know, we're going to be supporting National Testing Week, and not just this week, but moving forward. So do get tested, do reach out, do get in touch, and hope to see you soon.
Oh, thanks for having us.